Good morning. Welcome to another episode of PI Today. I'm your host, Dr. Nicholas Laloy. Today we have a very special guest. But first, I want to thank everybody out there for following us, giving us encouragement. This is truly a podcast to bring you information about the wonderful physician, products, services, and facilitators in the PI world. We've been getting very good feedback. Please tag us. Leave your comments. We'd love to hear from you. Any special requests, people or physicians that and specialties you want me to bring on the show. If you want to be on the show, if you're in the industry, please let us know. We basically take all comers. But today, I want to bring you something very rare. Basically, a physician, a specialty that is like a truffle. It is probably 1% or maybe less of the physicians out there and the specialties out there. Highly trained, but awareness is everything. This physician takes care of patients who, from minor procedures that are needed to extreme accidents, and I've seen firsthand, that truly gives people's lives back. When I say back, that he deals with deformities and things that basically, if you go face first out of a windshield in a bad personal injury accident, this is the man that really brings you back to life and gives you a quality of life. And I've had the pleasure of knowing him for almost 10 years. I've seen his work, his bedside manner. He's a friend of mine and a wonderful doctor. Without further ado, Dr. Moris Aynechi. Welcome.
Thank you so much. Thank you for the beautiful introduction. And it's truly an honor to be here.
My pleasure.
I've known you for about a decade, over a decade, and
Yes,
it's always been a pleasure working with you guys. And I really respect you. Thank you.
I appreciate it. Doctor, give us your background, your schooling, your specialty, because this is something that, again, I said it's very rare and super specialized. Tell us about your training so everybody can find out.
Thank you so much. Our specialty is kind of a unique specialty. It's very kind of a fluid. What that means is finishing college, we usually go to dental school. So 4 years of dental school, I decided to do a 1 year internship. So I did a 1 year of oral maxillofacial surgery internship, and then you qualify for residency, for a full residency of oral maxillofacial surgery, which is 6 years. In these 6 years, it's a combination type of residency where you go to medical school, you do your anesthesia training, and you get trained to be an oral maxillofacial surgeon. At the same time, you also do general surgery residency, but you don't complete a full residency. We did about 2 years of general surgery. So you get exposed to all fields of the medicine and surgery before you actually complete your oral maxillofacial surgery training. So altogether about 11 years of training after college.
Wow, wow, that's a lot of commitment, a lot of schooling. Now, oral maxillofacial, basically, is it a good comparison, or when I say it's from the neck up, it
Exactly.
is exactly what you treat. And what are some of the things that you treat as a surgeon?
So you could put it into different categories. So it could be anywhere between facial trauma, facial injuries. So somebody breaks the chin or breaks the jaw or breaks the teeth. We fix those. They have nose fractures. They have orbital fractures. So anything with the trauma related, that's within our specialty. And oral maxillofacial surgeons in general during their residency, they're the most highly trained of all the specialties in facial trauma, because we see almost most of the trauma that comes to a hospital in our training. Besides trauma with pathology, tumors, cysts of the jaws and the face, We do wisdom teeth, dental implants, facial reconstructions, jaw surgeries. What are jaw surgeries? Someone has facial deformity, or teeth don't come together, or jaws are too protruded or too set back. We move the jaws and put it in the right position to give facial harmony. Bone grafting, facial reconstruction, or post-traumatic reconstruction. That means people who had facial trauma, has facial deformity that you cannot cut the bones or put the bones back together. You make custom facial implants to get that facial harmony that they used to have, and reconstruct the face so they will look almost as good as what they used to be.
Amazing. So this ties into our other segments of traumatic brain injuries. So for everybody out there, traumatic brain injuries, they're not isolated just to the brain or the movement of the brain or adhesions in the brain or the swelling of the brain. Um, a lot of these patients or clients, when they have a traumatic brain injury, they have some sort of force, whether they hit the windshield, whether they hit their face, their head against something. I've seen in many many cases that even the doctors only focus on the traumatic brain injury when an accident happens. But the person has an orbital fracture. They're like, okay, well, it heal itself, or they'll have a nose fracture, and they'll say, okay, we might want to send to plastics or another physician, which might be okay. But the subspecialty for this is oral maxillofacial, and they tie in the traumatic brain injury with it, because Dr. Aynechi is a DMD and MD. So let's get that across. That's where you guys might get a little bit confused. He is a dentist and a medical doctor, where surgery is his big forte when it comes to reconstructive, when it comes to a nose that's smashed, when it comes to eyes, when it comes to jaws, upper lip. These areas are all within his specialty. So when you're looking at a traumatic brain injury and they have visible signs, or you think bruising, or you think they have some sort of fracture or jaw pain, that's huge. That is huge, and I'm going to let Dr. Aynechi talk about it. But jaw pain, because it's there's a joint here, and nerves, and I'm going to let the doctor talk about that.
You said it very well, and there's actually a lot to talk about. Uh, Patients who have traumatic brain injury, that means they've had a major trauma. So when they're in the hospital, the immediate attention is only paid to the orthopedic injuries and the traumatic brain injuries usually. And often the maxillofacial injuries are ignored. Not because they don't care, it's just because the patient has more pressing issues that needs to be addressed. Unfortunately, or fortunately, the body heals, and these maxillofacial injuries, they heal in a bad position, so they cause facial deformity. And so by the time the patient comes sees us, months or weeks has passed by, and you can't really put those bones back together. Now you have to figure out how you're going to make this patient whole with minimal damage or minimal morbidity to the patient. At the same time, these patients have a lot of spine injuries, neck injuries, orthopedic injuries. And most of the physicians and chiropractors, they concentrate on the orthopedic issue and the spine issues, and nobody addresses the upper half or upper 1/3, which is the neck and the head. A lot of these patients, they address the spine issue, but the patients continue to have neck problems. They continue to have headaches. They continue to have anxiety. What does that translate into eventually? they start clenching, grinding their teeth.
That's right.
And clenching, grinding is not so innocent, because I've been treating TMJ disorder, which is temporomandibular joint disorder, for many, many years.
Doc, do you mind if you point to that on the skeleton so a lot of people can see it?
That's actually really.
Watch, yeah.
I don't want to take the brain out.
That's okay. I think mine is in there.
Okay, can you see this well?
That's right.
Okay. So this part here is the temporomandibular joint. So this is the temporal bone, this is the mandible, temporomandibular joint. So this joint opens and closes like this, okay? Now, you have the masseter muscle up here and the temporalis muscles up here. And these are the muscles that close your jaw or put pressure closing your jaw. Pound per square inch, strongest muscle in the body.
Wow, I didn't know that.
It is.
Wow.
That's a fact. And by clenching and grinding because of the stress of the TBI, what happens is these patients, they put tremendous amount of pressure on these teeth and on these joints, okay? And by putting this tremendous amount of pressure, you're putting all that pressure in this small joint here. What do you have in the joint? You have discs.
I was waiting for you to say that. Things that are my specialty, but not there. You have discs. So listen up to everybody that does musculoskeletal. I bet you guys didn't know that. So go ahead.
So this disc is kind of a unique disc in terms of the temporomandibular joint, because this disc is actually attached by ligaments which moves forward and backwards with the opening of the jaws. And it's a translational joint. So a knee joint opens and closes.
Correct.
It doesn't translate forward and backward.
That's right.
It's fixed, sort of. But this joint, the mandible joint, not only opens and closes, it translates forward and sideways. So if this disc doesn't move in harmony with your lower jaw, what do you get? You get pain, you get popping, you get clicking,
impingement.
Impingement.
That's right.
And degeneration.
That's right.
And limited opening after a while. Cannot eat hard foods. They cannot sing. They cannot laugh.
And does that contribute to orofacial pain because of the nerves?
Significantly, because the ligaments that attach to the disc are richly vascular and lots of nerve tissue in there. So once the disc gets displaced and you're actually chewing on the ligaments that are richly full of neurons, you get a lot of pain. That's why people are like, I have a lot of TMJ pain. It's because they're not biting the disc. They're biting the ligaments.
That's right.
And adjacent structure.
And this can cause possible headaches?
It causes ringing in the ears, headaches, jaw pain, limited opening, unable to eat hard foods.
Correct.
Limited range of motion. One of my biggest referrals for TMJ disorder is actually ENT physicians, ear, nose, and throat doctors, because patients go to the doctor like, I have ear pain. I have ringing in my ears.
Correct.
They examine the patient. They do audiology tests. They do CT scan of the temporal bone. And they give him clean bill of health. So the patients end up coming see us, and we treat them for TMJ, because invariably all these TMJ patients, they transmit that pressure or the pain towards the ear canal, because even on this skull, you see this is your joint space here, and that's your ear canal. So distance between the joint and ear canal is very negligible. It's right there. So any pressure or inflammation could easily be transmitted to the ear canal.
That's
and
right.
And then interpret that as a earache.
That's right. And when I was practicing seeing patients, I would see MMA fighters or boxers or people who were athletic and taking blows to their jaws, and yes, they would come in with ring in their ears, ear pain, and it's very, very common with accidents. Very common with an airbag deploys. That force of that airbag that's coming out. I mean, I don't know exact numbers, but it explodes, and just we isolate. We seem to isolate everything to neck pain, whiplash, flexion extension. But the scope of this is much higher, especially when you get that blunt force of the airbag. Correct, Doc?
100%. Imagine the trajectory of any trauma that you usually get to the face, when ku and kanaku, when they go back and something hits them in the chin. So the first thing, if you ever see a trauma to the chin, it's just a small laceration, a small cut, nothing big, just a tiny bit. Always look at the joint, because if you draw a line through the jaw, it goes through the joint. And that force is directly transmitted to your joint. So imagine if you have an airbag or an assault or a car accident, which you hit your jaw, what does that do to that joint? It's going to tear the disc, it's going to displace the disc, it's going to cause a lot of inflammation there. And it could potentially be irreparable. Then what happens is patients they concentrate on just treating the cervical spine and the lumbar spine, and that goes ignored. What happens, patient clenches and grinds over the next months to years. It's not diagnosed. So you get disc degeneration, you get facial pain, you get headaches. Then if your crunching grinding gets severe, you could break your teeth. Interestingly enough, not even trauma related. Whenever there is a huge crisis in the world, I see more patients with teeth fractures. Not because they have bad oral hygiene, not because they don't brush their teeth, not because they have decay. Perfectly healthy teeth, we're removing because they got infected. Why? Patients get stressed, they clench hard, and the teeth lose their blood supply, and they just get cracks and fractures. And now we have to take the teeth out, we have to clean the area, we have to bone graft reconstruct it, then we have to put down implants there. Now we have to treat them for the TMJ disorder because we don't want them to break more teeth. And then now, after all this damage has been done, we make them oral devices to wear to protect their teeth and to protect their joint. What does the oral device does? It's basically a custom-made mouthpiece that the patients wear that would create a space between the upper and lower jaw. What does that do? By creating a space, you actually remove the teeth-on-teeth contact, and you sacrifice the splint for the teeth, because you could wear the splint out, it's softer and it has more cushion. Secondly, it would create a space between your joints, so no matter how hard you bite, it has a hard stop, so you can't transmit those clenching forces into your joints, and you save the joint. So the term is decompressing the joint. So that's one of the things you do for TMJ disorder. Patients with a traumatic brain injury, facial trauma, or just stress by itself. Now, the splint therapy is one thing that you do. The second phase, after doing conservative treatment like massages, the warm compresses, TMJ physical therapy, if you cannot break the cycle of this muscle spasm, clenching, grinding, parafunctional habits, then you might consider doing a botulinum toxin.
So this is not just to become pretty, but Botox for pain. Go ahead, Doc.
Botox treatment or botulinum toxin treatment has been a hallmark of TMJ therapy, at least in my practice, for the 10-15 years. It's one of the few medications that give you almost total relief and saves the teeth and the joint in the long term. And when I started doing this many years ago, it wasn't the norm. But I observed in my patients that the results were incredible. Fast forward 10, 15 years later, it's becoming almost the norm now.
And this is injections in certain areas.
Exactly. So botulinum toxin is just a term for like Botox or Evolis or different type of toxins which used for cosmetic reasons.
Correct.
And it's the same exact medication used for TMJ disorder. And where is it injected? Injected in the maxillary muscles, temporalis muscles. You do this sternocleidomastoid neck muscles, anterior and the posterior, front and the back. And patients with headaches, you could inject the 11s and the foreheads here with incredible results.
I wonder how that got discovered. Probably some Dolly Parton looking lady with a lot of TMJ problems was doing some beauty treatments and the pain went away. So it's amazing.
It's a good question. I think it's FDA approved for dystonia and patients who have like muscle spasms where like the necks turn and they cannot bring their neck back. So they started injecting Botox and said like, oh, the patient can bring their neck back. Or
That's
they have
right.
like a severe muscle spasms that wasn't being released.
Or cervicogenic headaches and so on, yes.
And it is FDA approved for migraines,
Correct.
So TMJ patients who receive TMJ Botox, if they have headaches, which is sort of like a migraine, when you do the temples, then you do the forehead, you do the back of the neck and the cervical area, they get almost within a few weeks it's gone.
Wow, amazing. So we learned a lot of things today. One thing I think we don't want to overlook, when people have bad accidents and have teeth fractures, Dr. Aynechi also takes care of that. He does the implants, he does the surgeries. I've seen the patients, the post patients. He does an incredible job, and over the years, I couldn't be happier working with the doctor. And anything else, Doc, that you want to add today to your wonderful specialty that you do?
Something that we discussed earlier before the talk show was I was just want to bring an introduction. I don't want to really dive into it. Is the exosomal therapy,
Stem cells.
stem cell therapy.
Oh, that is a very, very hot topic. We'd
Yeah.
love to hear some about it. Go ahead, Doc.
And we'll get into it in the next podcast, hopefully. Um, that for people who don't know what exosomes are or stem cells are, these exosomes were discovered to be waste of the cells before, and now we discovered that they're actually messengers that promote healing and promote growth and regeneration of the tissue. And we started treating our patients for TMJ disorders, injections into the joints to regenerate the disc tissue. We started using it for our regular surgeries when you do the bone graft reconstruction.
Amazing.
So when you do a bone graft, you actually open the jaw, you place bone there, you secure it in place, let it heal so you could put down implants in there. We've been using stem cell therapy to promote healing, decrease pain, decrease inflammation, and getting a better result.
Wonderful. There's a lot of studies out there that prove that fact, and we will dive more into that next time with Dr. Aynechi. I want to thank everybody today for joining us. As usual, we'll bring you the best information on PI's today's podcast. Join us next time. We're going to have more exciting guests. Again, Doctor, thank you so much for being with us.
Thank you for having me.